Dr. Currie here. Did you know that I work with a lot of people who have what's called sciatica? Now, what is sciatica? A lot of people ask me the question, Dr. Currie, I don't really know if I have sciatica or not. I'm having this horrible leg pain or pain in my buttock or pain in my hip, and different people tell me different things. Different doctors tell me different things. And so I'm going to break down for you what sciatica is. Now, in the spine, you have vertebra, okay? So you have the vertebra, which is a bone, and then the disc, and then the bone. And it's that way, all the way down your whole spine. Now, in the low back, there are nerve roots, which are these right here that come through these tunnels on the sides of the spine, on the right and left side. And so when the disc breaks down and becomes diseased, so people can get osteoarthritis or degenerative disc disease in their spine, which then in turn, when that disc space starts decreasing, then that narrows this canal and creates spinal stenosis, okay, on the nerve root, foraminal canal stenosis. So when people get that stenosis, then that can pinch the nerve that's then going to run down into the buttock or the hip area, the hamstring, the leg. It can go down into the calf. It can go down even into the big toe or the middle toes or the pinky toe, depending on which one of these nerve roots is pinched. And so it kind of also looks like this right here. So you see that disc comes out and then chokes and pinches that nerve that's going to go into that sciatic distribution. So one of the things that you'll read on an MRI report is you'll say that someone has a degenerative disc or foraminal canal stenosis or central canal stenosis from a bulged or herniated disc or from bone spurs, so on and so on. And that can be causing radicular type symptoms, radiculopathy, which is referred pain that comes out of the low back that then goes down the leg, and it'll go in different patterns depending on which nerve is pinched. And so I think it's important that you know this information because so many times it's disc disease, breakdown of that disc that causes the choking and pinching of the nerve, that causes the sciatic nerve pain. And so physical therapy helps some people because they can go strengthen the muscles and get those muscles stronger. But ultimately, if you have degenerative disc disease, you can have strong muscles and you can still just suffer immensely. People will go get a back surgery where they'll grind out or roto-rooter out around the nerve to try to create some space. But ultimately, the bone spurs can grow back and then become bigger than they were before the surgery, because then people end up with the same exact problem. When they do a partial discectomy, they trim off the part of the disc that's pinching the nerve, but guess what? The disc itself is still diseased. It's still compressed. It still can pinch that nerve over time. And so many of those people will still have the same problems. One other thing that they'll do is they'll do a laminectomy procedure. Well, they'll come in and cut out part of the bone back there to try to let the spinal cord move away from the disc. But ultimately, when the disc is still diseased, there can still be a lot of pressure being applied to that nerve. And that's why I treat so many people who have had that done as well. When they burn the nerve root, okay? Well, they come in and they burn the nerve root here to try to keep it from sensing the problem. But when that nerve regenerates over the course of 6 to 9 months or a year, then ultimately that nerve starts sending those pain signals to the brain again, saying that you're hurting really bad and suffering. And so the other thing about the radiofrequency nerve root ablation, which is the burning of the nerve roots, that it leaves behind scar tissue quite often, because when they burn that nerve, then it'll leave scar tissue behind in its place on the nerve root, which then can compound that problem and create new issues and new pains. And so ultimately, working with that disc, helping to try to help that disc improve its health, restore hydration back in the disc, is a great way to get at that disc and help improve the health of the disc, which in turn can free up the choke pinch nerve and can change lives in very special ways.